Let's talk about hiccups. What are hiccups? Well, we've all had them. You know what they feel like. It's hard to describe them, but this is the cause of hiccups is that sudden contraction of the diaphragmatic muscle, and they're involuntary, spasmodic, and they often involve those intercostal muscles that allow us to breathe. They only really need treatment when they become persistent and really bothersome. And if they're persistent, they can just affect everything in someone's life: conversation, concentration, oral intake. They can lead to frustration, even insomnia. They might contribute to an increase in pain, especially like I had a patient this week who had abdominal surgery, and every time he hiccuped, it just pulled on that incision site. It was so uncomfortable. The goal is to interrupt the vagal nerve stimulation, often in that diaphragmatic muscle. Sip on cold water, swallow crushed ice. That can help to soothe the diaphragm and interrupt the hiccup cycle. I find taking tiny sips of cold water while I'm holding my breath is my best thing. Breathing into a paper bag. This can help to increase carbon dioxide levels in the blood, and that can help calm the diaphragm. Interrupting normal breathing. Hold your breath for a short time. Take deep breaths. That can all help to reset the hiccup reflex. Rubbing the soft palate with a swab, that can stimulate the nasopharynx and help to interrupt the hiccup cycle. Some people eat a spoonful of peanut butter, and this probably works the same way. As it sticks to the roof of the mouth and then you have to repeatedly swallow, it interrupts the cycle. Drinking from the wrong or the opposite side of a cup is always talked about, and I can't figure out how to do that without just being covered with water. So if your patient's in bed, you can try having them pull their knees up towards their chest as they lean forward. This compresses the chest cavity and might help to reset the diaphragm. Here's one I'd never heard of. Breathe in a grind of fresh pepper, and that stimulates a sneeze necessarily, and of course it could interrupt the hiccups. If the hiccups still persist and there can be considerable discomfort, you've got to look at other things. When they're persistent, that means they last for more than 48 hours. If they're intractable, that means they last for more than a month. In the next video, we will focus on hiccups that are persistent and causing discomfort in end-stage disease, both for palliative and hospice patients. So, move on if you're in end care, hospice care work, and let's look at how to help our patients be comfortable in their end stage decline when they have severe hiccups. Thanks so much for watching. Get our booklet, go to our website, the Hospice Care Plan. We're the Care Queens, and our motto is care is treatment.